A pandemic of the unvaccinated.
If the virus would be going anywhere, it would be to those people who have not had prior vaccination or prior infection with COVID-19. And children happen to be the largest group of this.
So if it's a pandemic of the unvaccinated, and that's why we're seeing an uptick in kids, how do you think getting the COVID vaccine into kids' arms will affect this?
It should help. But the question is, how well will our parents in the community have their children get vaccinated?
Dr. Karl Yu is a professor in the pediatrics department at the University at Buffalo. He says the increase in COVID cases in schools is because vaccination rates are the lowest among children.
Vast majority of children will be fine if they catch COVID. However, a smaller number might be hospitalized. A small number do end up in the ICU.
Do you think that this is spreading in schools or it's being contracted outside of school?
It's probably being spread in schools. And the reason for that is we've had many patients who have been admitted in the children's hospital with COVID. And I basically asked them, where do you think you got it? And they basically say, okay, there was this classmate.
Dr. Yu says right now, more COVID patients are admitted to the children's hospital than ever before.
We do not have a lot of children admitted for COVID, thank God. These are only a small handful. It is higher now than it has been in the past.
If vaccination rates in children don't increase, what could happen?
We will have the status quo for a very long time. That's pretty much it. The epidemic will not end until we have herd immunity.
Olivia Proya, 7 Eyewitness News.